This guide will walk you through the steps of assessing your client from the back or rear view during a static postural evaluation. Once you have completed your side view postural evaluation, upload your client's photo for the back view. Start by leveling off the image by lining up the junction between the floor and the wall. Then place the plumb line vertically and evenly between both feet. The horizontal line is placed directly on top of the head or skull. Clicking Next, we can start to annotate the image. First, we look at the shoulder blades. We line up the bottom inferior angle of the two scapula to see if the shoulder blades are at the same height, or if there's any elevation of either scapula. At the 12th ribs, again we would need to touch the client. We feel the bottom of the ribs and then line them up in our app to see if one side of the rib cage is higher than the other. We do the same on the back of the knees. We look to see if the lines on the back of the knees are at the same height, or if there is any leg length discrepancy. Next we are looking for any protrusion or rotation of the inferior angle of the scapula. Is there a complete unsticking of the scapula at the medial or internal border? Do we see a winged scapula? If so, this could indicate a weakness in the serratus anterior muscle, which is often associated with upper trapezius tightness and neck tension. A downward rotation of the scapula can be seen here. This indicates tightness in levator scapula and upper trapezius, with an associated weakness in the serratus anterior muscle and lower trapezius. Next we are looking at the shape of the spine. Simply choose the spinal shape that best matches your client's spine by clicking in the box provided. If the spine is straight, then we just select straight. At the feet we're looking for any rear foot pronation, rolling in of the heel, or supination, rolling out of the heel. If we see excessive pronation at the alignment of the back of the heel, we use arrows facing in. If we see excessive supination, we use the arrows facing out. Both of these unsafe rear foot positions increase the risk of injury due to poor joint alignment and muscle imbalances. In this guide, you learned how to assess your client from the back view during their static postural evaluation. This completes our series of assessment views for the static evaluation. In the next tutorial we will be looking at the process of assessing your client's dynamic posture with multiple tests to determine muscle imbalances, poor dynamic joint alignment and injury risk potential.